All right, so the thanks really has to go to you, Dr. Deb, because like you just said, you're tech savvy. Without you, I could not even put this together. So I greatly appreciate the opportunity. Number one, for putting this together, but number two, for welcoming me into Serenity to help bring these services to offer to your patients that have trusted you for many years. And I look at this when we were coming together of how do we put together a presentation to offer clients and prospective clients about this new wave of healthcare. And it shouldn't be new because this has actually been an offering for several years, but because of misinformation, people have been very confused in this space about what regenerative medicine is. In fact, I was too. Over 20 some years ago, I was brought into this space not by choice. Like you were sharing, I was trained as a chiropractor for the past 23 years. I've been a licensed chiropractor, and I initially entered the space of health and wellness of helping people with biomechanical issues. Obviously, as many of you know what a chiropractor does, we check the spine for misalignments, but more importantly, we really affecting the nervous system through those chiropractic alignments. But even further down the line, we're affecting the cells. So the one thing I'll ask you all to keep in mind here is when we're talking about regenerative medicine, we're talking about how do we get our cells to function the way they're designed to so they can communicate with one another in such a way that allows the body to do what it was designed to do for the long term, if you will, to adapt to the environments we provide. And unfortunately, it's really come to the forefront in the last few years of the environment that has been provided has actually caused a lot of insults to ourselves and to our systems. It's minimizing some of the things we were doing before for our bodies to be well. So when we're putting this together, and I looked at this, at the topic of this, and saying, how do I speak to the audience, and how do I bring a message to them to share my story of how I got in this lane, but more importantly, how do I share the opportunity to them to determine maybe they might be a candidate for these things or someone they know, like Dr. Deb was saying. And so regenerative medicine, if many of you don't know what that means, it's really simple in looking at the breakdown of it. So regenerative is basically anything that's able to reproduce or to regenerate or to restore, if you will. And then medicine is obviously can be used in a negative connotation, if you will. So I don't really like the phrase regenerative medicine. I look at it as more restoration of your cells. So my story actually began, and I think about putting this together, was my story was back when I was involved in a boating accident. And it was a very traumatic boating accident that put me in this lane. So I remember the day that I heard about regenerative medicine, and I was very puzzled because there wasn't much information out about it. And it was very almost like voodoo because there was a lot of things going on about people using these aborted fetuses for stem cell therapy, and these different things that were really kind of out there. And so when it was first introduced to me, I was really concerned on what the heck is this stuff? Right. But I was put in a position, oftentimes things happen to us, and we think that's happening to us, I should say, but it's happening for us. So I had just finished chiropractic school and got into practice and practiced for 3 years, opened a business, and was involved in this traumatic boating accident where I'd fractured my distal radius and my humerus. And so it put me in a position to think, how the heck am I going to move forward? Or will I be able to use this wrist to deliver chiropractic adjustments? And so it just happened that God put people on your path for a reason. And I had a friend in Colorado that was just getting into this regenerative medicine space. So he invited me out to his clinic to talk to me about this regenerative medicine. And so I was obliged, like you are now, of let's have the conversation. Let me hear more about it. So as I met with him, it seemed very promising. I trusted the fella. He was been in practice for several years, and he was on the cutting edge of things all the time. And so what was offered to me was to doing some injections into my wrist to help accelerate the healing process, to get my cells to basically supercharge them, if you will, but to go back to that youthful state so I can condense time for healing. And I was very hopeful as I had the conversation, information was shared, and it'd take quite a few months before I noticed anything. So I was really questionable on if this was really truly something that would work. And it turned out to be a few months later, and all of a sudden it just turned the corner. And at that point, I was like, we're onto something. And so then I had to really reassess, how is this happening? Because I was so focused on structural alignment with chiropractic and getting things moving correctly, but I wasn't thinking about the cell level. And that's when we taught in school of taking things back and really figuring out how do we get these cells to function and to be able to continue providing us the environment that we want or the lifestyle we want based on the environment we're providing. So minimizing the toxicities and supporting the deficiencies was the definition of how do we adapt to our environment to get to what we call homeostasis. And so at that point, I had to look back and say, you know what, we have to get back to the cells here and think about the cells. And so that's really what regenerative medicine comes down to. So if we can really think about how do we provide our cells with the right information environment so they can continue to allow us to flourish and heal the way we were designed to. Like if you cut your arm, it heals. You don't have to think about it. So I'll ask you to really think about regenerative medicine that way, not about these cells or this magical potion, if you will, or this magical technology here to take care of all these different dysfunctions, but we're doing it one cell at a time. So, what I'd like to offer you is the opportunity to be open-minded on when we talk about these things, that we're not just trying to treat symptoms. We're not trying to treat, we're not trying to prevent, we're not trying to offer you any cures per se. We're just trying to support yourselves. So, we're going to start off the conversation talking about the disclaimer you see in front of you there. And I'm just going to read it out loud so we have it recorded here so that we don't put ourselves in a situation where people are feeling like we're giving them some sort of false hope or diagnosis or giving some improper language. So the disclaimer states that this is a company that we use for our biologics process, which we'll talk through later, but we'll first talk about the shockwave device. But this is a biologics company we get our biologics from called Platinum Biologics. And their products are not FDA approved or licensed for the prevention, treatment, diagnosis, mitigation, and or cure of any disease or condition, including COVID-19. And the reason we put that disclaimer is to protect the conversation and language that we're using, okay? All statements and opinions provided are for educational and informational purposes only, and we do not diagnose or give medical nor legal advice. Individuals interested in natural biologics therapy are urged to review all pertinent information and do their own research before choosing to participate in treatments utilizing natural biologic products. All platinum biologic products are for cosmetic, topical, research, and or homologous use. All right, so that disclaimer allows us to now start the conversation. But let's start first talking about shockwave and how that fits into regenerative medicine. So these slides are provided for an outline because as many of you will have that opportunity, I hope, to meet with me. I love to share information, and sometimes we can go down and share a lot of information. So it's keep me on point here, but also a reference to you. If I go off of the conversation outline, you have a resource that you can reflect back to. So you have this to have as an evergreen opportunity to refer back to, okay? And I don't want to sit here and read all the slides to you because that's boring. As a student, I just didn't like doing that. So for me, my idea of doing this presentation was to have a conversation, and Dr. Deb said, hold on, you need to have some structure here. We need an outline. So she was so kind to put this together and help me make this happen for you. But basically, like I shared before, regenerative medicine is helping the body to repair, regenerate, and restore optimal function. And we're talking about optimal cell function. So I'll continue referring back to that phrase because I want you to start thinking about your body as a conglomeration of cells. So research says we have about 40 trillion cells. And so we have to think as a host to this body, what kind of environment are we providing? And I like to share it in this way. It's the three T's: thoughts, traumas, and toxins. What kind of traumas have we put our body under as far as a physical standpoint, from the falls, the injuries, the broken bones, whatever we might have done physically that stressed our bodies, that caused it to be overwhelmed, that presents now into maybe some symptoms we're having because of joint dysfunction. Also, the toxins, the things we're consuming in our environment, whether it's the air we breathe, the water we're drinking, the foods that we're eating, or things that we shouldn't be eating, drinking, or inhaling. That will affect our cells as well. And the other thing that most people don't talk much about is our mindset. Like we were just talking a little bit ago about that positive mindset affects our chemistry as well. And oftentimes, and I'm sure most can relate to this, when you're very emotionally stressed out, it causes systemic inflammation. When we have systemic inflammation, it also increases localized inflammation to areas that maybe are vulnerable or areas that were maybe not functioning 100%. Now they come to the surface as the symptoms. So believe it or not, systemic inflammation will definitely increase the localized areas of irritation. So thinking about that, when a person gets stressed out, all of a sudden their low back starts to bother them. Well, clear that low back was vulnerable and not functioning correctly. And I can remember back in chiropractic so many times people would come into the office on Monday morning, Doc, my low back is killing me. I threw it out yesterday. I said, how did you do that? Because I always like to joke with patients, make it fun. So did you throw it out the window? I mean, where did you throw it, right? So he's saying, how did that happen? They said, I picked up the paper and I went to stand up and I threw my back out. I said, well, I know Sunday's paper is a little bit heavy compared to the rest of the week, but it's not the paper that threw your back out. The stage was already set. So the same thing with emotional stress. So I call, like I said, the three T's to consider into your routine of your life from where you are now to previously, how that got you to where we are now in this conversation. And then we come on to, what does shockwave therapy do? So shockwave therapy is this device I have here behind me, and it's a non-invasive treatment. What that means, it doesn't require any type of surgery. So it's not going to cause you to have a risk factor, if you will, and use this device to help reduce that inflammation, that overall pain and discomfort, but also help the body to repair and start the repair process. So these different devices we have here are going to be talked about separately, okay? But this is the overview of what shockwave is. And as you can read there, what it's doing is releasing different cellular processes to help your body regenerate, heal, and recover. But the most important thing that people don't understand, and like we were talking about before we got in this conversation, is if we use this device for people that have had chronic injuries or degeneration, we can use this device to clear out any type of scar tissue to set the stage for that healing process if we choose to offer biologics into the joint spaces we're trying to help support. So what ends up happening is this device has many different uses depending on the device that we use, okay? And so research has shown, actually surprisingly, if you even do ChatGPT, you can find out these Shockwaves devices hadn't been cleared by the FDA in our country since 2015 or 2016. This particular device was cleared. So it hadn't been that many years. Where I have friends over in Europe that have been using this for over 25 years. As you know, in our country, it takes a little bit longer for things to get promoted to allow us to use these things. So two different devices we have here, and we'll talk about them independently. So next slide, if we can. So we're going to talk about the difference between focused and unfocused shockwave. So the difference here, the one that I use with patients here at the office for joint complexes or any type of connective tissue is the focus shockwave. And the reason I use that device is because it helps clear out and it can penetrate much deeper. And as you see here, it can penetrate up to 8 inches into the tissue. And what does that mean for you? It means if you have a lot of chronic issues in that joint complex that have been developing a lot of scar tissue, I can get down to the source of those problems and clear that out to allow the joint the opportunity to get to restoration of full elongation to allow that process to occur as we're allowing the healing to occur for the patient in their particular joint that they're coming in with problems with. As opposed to some of the other devices out there that are unfocused, the depth of penetration, as you can see, is just about 2 inches. There's more surface level, helping with more superficial inflammation or mostly muscle groups. Well, the device that I use is mostly for connective tissue, meaning tendons or ligaments. And then oftentimes this is actually designed and FDA cleared for small bone fractures as well. Next slide, please. So as you can see here, we want to also talk about the difference between shock waves and ultrasound, because people ask that all the time because the applicator itself, it looks kind of similar to what ultrasound would be. I don't know if you can see this. Can you see this, Deb, the instrument?
Yeah.
So you can see on the head here, there's actually this barrier here. It's almost like a silicone type of material that transmits, or it allows for the transmission of these shock waves through. So some people say, is that ultrasound? And what's the difference with ultrasound versus this? Because you're talking about sound waves, you're talking about shock waves. Well, it's a different frequency. So that chart there illustrates the difference. So these are acoustic waves that this device delivers versus sound waves that ultrasound delivers. And why is that important to you is because, like I said previously, this can go a lot deeper into the tissue cells with it being focused versus unfocused, but also the same with ultrasound. That is very surface, and it's only designed to increase blood flow and to help heat the area for pain relief, not to actually help with healing or regeneration. So that's the difference with a shockwave device versus an ultrasound device in helping with healing and promoting tissue regeneration. Next slide. So this has been, like I said, FDA cleared for joint pain. And the first joints that it was actually cleared for was a condition called plantar fasciitis. And what's really great about this device is, like I said, it's multifactorial how it works. And so that big word there at the top here says angiogenesis. What that is helping with encouraging new blood vessel growth to damaged areas. And the reason that's important is because we need blood flow to excrete waste products, but also to help bring in and drive in nutrients and nutrition to help these tissues heal. And the reason it's more important for the ligaments is because, as many of you probably know, or if you don't know, you're going to come to know, is ligaments do not have very good blood supply. So if we have ligaments that are damaged, if we don't have proper blood supply and we don't have enough blood supply, that's a really long process. So if I can help the supporting tissue around that to feed that with new blood flow and new blood vessel growth, now we have an opportunity to help condense that time. And they're again helping reduce the inflammation, breaking down the scar tissue. That's what calcifications are, the fibrosis, breaking that connective tissue down. So we can allow those muscles to do what they're designed to do, to go to fully length or elongation, if you will, so the joints can move properly without the restriction. And then another cool thing about this device, it activates your body's dormant stem cells that come to an active state. So that's really cool. This chart here, or this slide here is showing you the difference between the different energy levels. So this particular device I have here, we're going to stay in that range to 0.4 maximum because we don't want to get into what we call lithotripsy. And many of you on this call, I don't see all your faces, but I can assume that some of you have had experience or heard about kidney stones in the past. And what they used to use lithotripsy for is to break up kidney stones so people can urinate and get rid of those as opposed to having any type of surgical procedures. So this is an actual handheld lithotripsy where it breaks up that potential of scar tissue. And if we take up the higher energies, it could break up kidney stones as well. So that's the other benefit with this device, and breaking up that webbing or that tissue webbing, if you will, to help us support what we're trying to do with the metabolic activity here in the healing process. That's what I wanted to provide this slide for you. The dynamic effects of this is really kind of cool because when patients are here, and I'm using this as a diagnostic tool, so I'll scan over areas of complaint for the patient to get an idea what tissues all involved with the symptoms they're presenting with. And as I run this device over top those areas of symptoms, oftentimes what they'll feel is they'll feel some pain or discomfort when I go over tissue cells that aren't functioning correctly. So I'll ask you to visualize a grape versus a raisin. So a grape is nice and round, and it has what we could maybe say we could drop it, it could bounce. Just play with me here. If I were to drop a raisin, it doesn't have the ability to rebound, if you will. So it's very similar to cell membranes. So these acoustic shock waves, when they're delivered into the tissue cells, what happens is if the cell membranes aren't pliable, they are not able to deflect the shock waves and to absorb that so the body can recognize it as being safe. There's no threat. However, the membranes aren't able to work with the shock wave. It absorbs that and it cavitates it. So actually we have these bubbles, if you will, of cavitation and bursting of these cells. So what people say is I'll go through an area and they'll feel it, helps me direct where the damage is. And as we start to concentrate that area, we'll feel less and less pain. The patient's like, how's it happening? Well, it's happening two ways. Number one, it's reducing those signals of substance P that goes to the brain, which is P for pain. It's going to shut down those signals to the brain saying that we're safe. But number two, what it's doing is cavitating those areas to allow those cell membranes to flush out. So we're metabolizing and then mobilizing those damaged cells to help with the healing process take place. So that's what this slide's really talking about as far as cavitation goes. And this is an illustration of what that looks like as we're going through here, because it's almost like a chain reaction of all these cells because they all lined up together in our bloodstream and in these tissues. So as we're penetrating those cells and they deflect, we're allowing this to go down this chain so it can affect its neighboring cell as well to help this process come along. So I'll find an area of concentration where maybe an origin insertion of a muscle or a tendon is, and I can track this back and I can affect that whole line of cellular dysfunction to support this process of this cavitation. And there again, coming back here and talking about the forces, the pressure forces, and why that's important. And that big word there, mechanotransduction. And that's really coming down to helping us understand why these other benefits are here and the biological effects of that. Because that pressure wave is almost like if you hear, like in the air shows, you hear these big jets, you hear it, it's already passed. So the same thing with the shock wave. It's very fast. The acoustic wave is so fast, it actually breaks the sound barrier. So as it goes through our tissue cells, it's going through that phase, going through the individual cells at a rate of speed that we can't even respond back to until we come to a cell that's dysfunctional, and we have this mechanical transduction take place and allowing this other stuff to occur. And that's where we're having, this cavitation of these cell membranes. And there again, you can see that whole list of things that this does to help support you and help the body heal, to allow this process to take place here with these shock waves. This is the two different shockwave devices here. The one on the left-hand side is the one that I use for the connective tissue, the one we're using for joint complexes. And as you can see, this is a slide actually from the company stores. And it shows the one on the left is, like I said, for the connective tissue and the joint complexes. The one on the right is more for superficial, and we use that for ED actually. So we can help the superficial tissue as far as the penis, or we can use it for muscle tissue as well. So we don't have to go as deep, if you will. And as you can see here, we converted over to as far as inches, but if you want to see the conversion there, nanometers to inches, you're going to see that correlation from the previous slide of depth of how these shock waves are versus the radial pressure waves of the other device. And this is what we talked about early on about stem cell therapy, because now we've been able to bring this, and I'm excited to bring this to us now. I mean, it's been a long time coming, and now we're seeing so much more support. People are getting out there sharing their experiences, and people are more willing now to entertain the idea of using this cell therapy to help support their cells. And like I said earlier in this, excuse me, in the disclaimer, we're not trying to offer you a prevention or a cure per se. We're offering to look at these cells as supportive cells. And these cells have been named MSC. So what they were called is mesenchymal stem cells in the past, but now they actually think about changing that to really help people understand what that means. And what they've now trying to coin the phrase to me is medicinal signaling cells. And if you think about that, back was prefacing this with you and thinking about things on a cell level, it's basically getting these cells to communicate together and going back to that medicinal phase, if you will, of remembering how they're supposed to function the way they've been pre-programmed to function. So these cells are supposed to go in there and communicate with your cells to help remind them to go back to that youthful state, if you will. And that's why we can really truly say these cells are coming in to help support that healing process, as opposed to the thinking of, I'm going to put these cells in here and these cells are new material that are going to be the building material. These are the communicators to help remind your body of how to do what it's designed to do in the first place. Okay. And so this is a company here that we use. That's one of their products there that are cryopreserved that we get from these scheduled full-term births from these donors that are donating their umbilical cord and their placenta, and that we're getting the cells from those tissues. These are pre-COVID tissues. These are pre-vaccine tissues as well. So they're safe of having any issues or concerns about that. But these are also immune privileged cells. What that means is it minimizes and mitigates that risk of rejection. So you heard people having organ transplants. Oftentimes they have to give them immunosuppressive drugs so their body can accept that new organ. Well, these cells come into the body and they're already accepted because they're what they call immune privileged. There's no rejection rate to these cells. They come in as blank cells. So that's the reassurance of how these cells work in that cell-to-cell communication. So there again, we're getting older. We're going through that aging process. We lose those cells. And so what ends up happening is as we start to lose those cells, that what we call proliferation starts to reduce, so that duplication or replication reduces. And so now we introduce these cells back in the body. Now we have a better opportunity to signal that process to reignite that youthful state, if you will. And like I said, the sourcing of the cells, like I shared with you before that last, I was just sharing that these cells are sourced in an environment that is going to be immune privileged, but also, it's going to be that pre-COVID, pre-vaccination tissue sourcing of these cells. So like I said before, I have a lot to say. I talk pretty fast, so I hope that I was able to entertain you in the conversation, but at least now we have a resource or a reference for you that you can go back to and look at the slides and listen to the conversation we had. But I think in these type of settings, the most benefit or the gems in the conversation is in the Q&A, because these are really addressing those concerns that you have, because all of you can go online or you can go to ChatGPT now and get most of the information that we're providing for you. That was an outline for that. So not to minimize that information we provided, but I think the real conversation starts now with the Q&A to help really guide you and direct you to see if you qualify or you would be a qualifying candidate for these procedures, whether it's for the shockwave or for any of these biologics. So I'd like to introduce the conversation now with some Q&A of some concerns you have or some things you read about, or maybe some things that may be holding you back of maybe having the conversation before that maybe you're ready for now.
I'll unmute everybody. We can do that. I'll just ask you to unmute. If you don't have to unmute if you don't want to, but if you have a question, feel free to unmute. And then I have a couple of questions here for you too. So I'll just do this. Okay.
So first off, let me ask a question. How many of you have heard about regenerative medicine before tonight?
I heard of stem cell years ago through an orthopedic surgeon that was on the horizon. It just wasn't available at that time. That had to be 10 to 15 years ago. So I was waiting for it to be more available.
Okay.
And he said it would help people.
So when you hear that phrasing stem cell, what comes to your mind when you think about stem cells?
Something that's alive and that would start a healing process. It's a natural healing. So that's what I think about.
Okay. So did that make sense what I was sharing with you? We're getting these cells to communicate with one another. So these cells are coming into your environment to remind your body of what it's designed to do naturally.
Yes. Yeah,
Thank you for
absolutely.
sharing. I appreciate that.
You're welcome.
Dr.
We
Chong,
haven't met, but I look forward to meeting you.
I'm there tomorrow with my daughter, so we'll meet you in person.
Fantastic. I'll be here too.
Okay. Yeah, you better be.
So one of the questions that's in the chat for us is, who would not be a candidate for this type of therapy?
We find a lot of people that are either currently in a cancer diagnosis, for example, even though research does show these cells actually will help mitigate, but I don't want to position myself in a liability spot there. But there's more research coming out that you're going to see that here in the near future that people are going to use to these MSC cells that are coming from donors, not from your own cells, to be a good source to help support and mitigate some of that.
That's awesome.
People with also for shockwave, people that have had appliances in for their hearts, that could be electronic devices that could cause issues with that because this is electromagnetic. So it's providing electrical frequency. We don't want to have any irritation or any risk of that.
Yeah.
Okay.
Good question.
Another question is, would this complement red light therapy?
Absolutely. So red light therapy, depending upon the nanometers or the frequency of red light therapy, that is designed to increase blood flow and circulation. And I often offer patients the opportunity to bring that alongside to support the work we're doing with the shockwave device. Because the shockwave device is a vasodilator, but that's only one small fraction of what this does, like you see in the slides. So that red light therapy post-treatment or during treatment is very helpful to keep that process going so we can mobilize the debris as we're flushing tissue cells out, but also encourage that nutrients and nutrition to get into the cells to help with that regeneration repair process.
Awesome. And
there's several different red lights out there. I'd encourage you to do some research on which ones are providing that full spectrum red light because the different nanometers have a different impact on what you're trying to support. So there's a company called Therasage out there that you can look into. Robbie is a great friend. I've done a couple podcasts with him actually talking about his technology. And that's a good company. It's very affordable products. And they are very science and research-based products. So you can check them out. One product called the Tri-Light that people can use that have knee issues or have shoulder issues or small joint issues, even low back. And they can wrap it and it'll actually mold around the area we're trying to support. And I actually use it when I'm traveling sometimes because I can plug it into my USB. So it's a good company to look into for red light.
Next question is, are there any side effects to what we're doing?
Not with this. We will have sometimes some inflammation or a little bit of swelling temporarily at the site we're working, even with the injections. But like I said, the cells are immune privileged cells. As far as the shockwave goes, sometimes there is a little bit of pain or discomfort. And the reason being is as I start to unravel some of the scar tissue, it causes some of the other soft tissue to have to work a little bit differently to move that joint than it did before, or given a different responsibility. So sometimes it could have some pain or irritation with that.
And how long does it typically take before people will start to see improvement?
Everyone's a little bit different depending upon the background and what they're presenting with. Some people feel instant relief because when we use a shockwave there again, we're mitigating some of what we call substance P. So that down regulates that pain reception to the brain. So to reduce that pain and inflammation, that patient will temporarily feel some symptom relief as we're starting the process. So that's good and bad. And the reason is sometimes it can be bad is because when people feel pain-free, now they think, hallelujah, I'm healed. And they go back into activity that their body's not ready for, that joint complex is not ready for. So again, like I said, everyone's different, it's case by case, but more often than not, they'll have some pretty instant relief just going in for their first treatment. And we go through a protocol. It's a process, just like healing with anything. It's a process. And I always tell people, and they ask me, well, how long is this going to take? I said, I really don't know how long your body's going to take to heal because everyone's different, and you're the host of the party. So you really determine the environment you provide for these cells to thrive. And so I oftentimes joke with these patients. I say, how about we take a knife and we cut your skin and we watch the healing process? And so I say to them, so how many days will you have pain or irritation from that cut? They say maybe a day or two. I said, what ends up happening? So it'll scab over. I say, so if I go in there and I hit that scab, what ends up happening? Starts that process over again. So we have to really appreciate healing does take time. It's one cell at a time. We're going to help try to support that the best we can by giving you information to be the best host, to provide the best environment for these cells to thrive and give you that background stuff that maybe you didn't know that could be insulting or aggravating the condition you're presenting with.
Mhm. And how is shockwave used if somebody has sciatica, but they don't really know where the cause is coming from? This is one of my favorite questions, actually.
Well, it's the coolest thing when I've learned this device because people oftentimes come, even when I was in chiropractic full time, they were coming in for a symptom that was an effect of something else that was dysfunctional. So when I use this device and I scan over tissue cells, you can actually then help give feedback immediately. When I go over tissue cells that are damaged, it gives me that feedback with this device, but it helps me then navigate the anatomy to figure out how is that joint supposed to function. And I can explore the surrounding tissue to see if that was a contributing factor of the symptoms that they're having. So that's what's really cool is because even though they're having sciatica, doesn't mean that that source of the problem, that's the effect. And if we just treat effects, we're chasing things all over the place as far as symptoms go. It helps me get to the source and the cause of the problem as far as where the biomechanics are altered, where the dysfunction's at.
That's awesome. I've got another question here that came in online is, this person's been to another PRP or stem cell clinic to get cells. What makes our clinic different, or the process that we're doing different from, say, a QC Kinetics or Regenerix or something like that?
Yeah, I love it. So that's a two-part answer, okay? And this is the two-part the answer to that question. We use the shockwave device for every patient that comes in for a joint complex disorder. So I can then use it as a diagnostic tool to figure out what we're really dealing with. Is this a tendon? Is this a ligament? Is this musculature? And what is the best protocol for that particular case? And if we don't have the whole background with what's going on, I can't give them the best sustainable outcome because I can temporarily treat symptoms, but I can use this, like I said earlier, to clear out any scar tissue. So if I went in there and I don't care if it's the best biologics out there, if I went in there and injected a biologic, a stem cell product or a PRP product into a joint space that was dysfunctional or is providing symptoms, it's not clearing out all that scar tissue. It's not restoring proper mechanics. So if I use this as a precursor, if you will, or a preliminary diagnostic, number one, but number two, as a treatment modality prior to the biologics, now I'm setting the terrain to have a better, long-standing, sustainable outcome for these patients that came with biomechanical issues. And so like I share with a lot of patients, I want to till the soil before I plant the seeds. And that's what this device helps me do. And the other part of the answer to that question is this. Not all PRP is the same, and not all stem cells are the same either. So PRP is platelet-rich plasma. So a lot of times you hear people pulling out their own blood, spinning that blood down, and concentrating, pulling those platelets out, injecting it someplace else in the body. Keep in mind, those cells are as old as you are. And those cells have the same amount of damage that you have. The cells that we can offer you, these are cryopreserved cells that are sourced then from the umbilical cord and from these MSCs that are age 0 cells. So their duplication rate, their viability is much different than your cells. That's number one. Number two, the stem cells that we pull or extract through it's a BMAC procedure where we're drilling into the iliac crust of the person's pelvis and pulling their stem cells out and putting them back in their body. One thing you have to realize is that stem cells are attracted to inflammation or cellular dysfunction. When those cells enter your body, they're going to be attracted like a magnet to those areas where there's been damage. So when I go in there, I create an environment of trauma by that drilling procedure. Where are those cells going to go to? They're going to the area of acute inflammation or acute damage or trauma. So now, in fact, what do we really do? That's common sense. So there again, also, those cells are the same age as you are, and the replication, duplication, and the viability of those cells is also diminished versus age 0 cells. So we're using the device to clear the terrain, to prep the terrain. Number one, that's different than other clinics. Number two, we're sourcing our cells from age 0 cells, pre-COVID, pre-vaccination. So the replication and the viability and success rate is escalated dramatically.
Excellent. So if somebody had PRP or exosomes injected into a joint space previously and really didn't see a lot of success, would they still be a candidate for the cell therapy and the shockwave therapy that we're talking about doing now?
Absolutely. And that's a great question. We had a patient come in with just that same case. And what happened, like I was sharing previously, if we don't take care of the underlying issues or underlying causes, how do the cells have an opportunity to do what they're designed to do? We have to remove those insults. We have to remove those limitations to allow the cells the best environment for them to be the most viable to provide the outcomes we're looking for. So these people come in that have had other cell therapies. If I can go in with a shockwave and isolate those areas that were causing some restriction or causing some irritation and continuous irritation and problems in the joint space and clear that out, well, now we give those cells an opportunity to go ahead and do what they're designed to do.
Great. So we have another question that if you've taken the vaccination, and I'm assuming they mean the COVID vaccination, could the shockwave therapy clear out the spike protein?
I don't know the answer to that question. I've never been asked that question before, so I don't know.
We don't know about shockwave, but we do know about ozone. And so ozone with UVB light has been proven in studies abroad to get rid of the virus. We are unsure about whether or not it'll get rid of all of the particles from the vaccine itself, but we know it gets rid of the spike protein, which can significantly improve your health for sure.
Well, what I can tell you though is that we currently have a patient that has been on oxygen for 3.5 years. It's actually my sister, and she didn't do the vaccination, but she had very, very high spike proteins. So that's the difference here at Serenity. If you don't know or you're not a patient here, we like to figure out what is the terrain, what is the cellular environment before we offer these type of procedures oftentimes. So we make sure that you're the best candidate for these things. So we can then also measure, so we objectively can share with patients, the ones we're working with or the ones in the future, saying, here's the data that we have. And data is objective. We have the information here. So what we're going to do is we're going to go ahead and check her spike proteins after we run it through the protocol and see if it changed the environment, see if we change the terrain, and see if we change around how her physiology is after we offer these procedures and protocols.
So I'll share with you my story. When Dr. Chong came to us, I knew about shockwave and was really excited about doing this. I have a really damaged neck from multiple injuries. And I was ready to go see someone in Florida, which I did do, had a big workup done, was looking at doing prolotherapy, but it would require me to travel to Florida every 4 to 6 weeks and have them inject 70 cc's of fluid in my neck. After the first time, I was not thrilled about doing that again, let me tell you. But I was in enough pain that I would have done anything because at the end of the day, being on the computer, my neck was so sore, I had to go lay down. And Dr. Chong and I said, can shockwave do something? And we weren't quite sure if it would help the way prolotherapy and this other alternative therapy was going to do its job. And we started using me as a guinea pig. And we learned quite a bit about what this could do with necks and cervical instability and occipital issues. And we did 6 or 7 treatments, and I literally at the end of the day have no more neck pain. I have no more headaches. My TMJ is reduced by like 50%. It was incredible the difference that just doing the shockwave made for me. I was seeing the chiropractor every week for adjustments, and I'd see him on a Friday, and by Wednesday I was in so much pain I had to see him again. I have not seen my chiropractor now in a month. And I can go, it's been 2 months since he's actually injected or adjusted my neck, which would have never happened before. So, I mean, it has made a huge difference for me, just doing the shockwave therapy. And we didn't do any injections in my neck or anything like that, other than the prolotherapy that I had done in Florida. So it made a huge difference. And we've been seeing the same thing with other people in our practice as well.
Well, the cool part about it for me every day is like I tell patients, the device does not discriminate. It sends the same acoustic wave out no matter what tissue I go over. So it helps me identify, even if a patient doesn't tell me what they have going on, it'll help isolate. And so it's a really good confirmation to patients like, wow, we found it. The device finds it. So it's been nicknamed the truth teller because sometimes they have a symptom someplace and I start to scan other areas based on my background anatomy, knowing where to go and try to to patrol the area. If well, I call it mapping, map the area out to figure out what could be contributing factors. And sometimes you'll find an isolated area outside of where the symptoms were, and then all of a sudden it starts to calm immediately that area that came in with the symptoms was. So it's a great diagnostic tool. It helps confirm to the patient they're in the right place and we have the right thing to be able to help them with that. So for me, it's a great guide and tool to help support that. And I'm just glad that you trusted to bring it in the clinic here and offering it to your patients, and that we're on this call right now and sharing this information, because there's so many people out there that are suffering unnecessarily.
So Barb has a question. If she had stem cell injections and soon after had an injury of some type, will the injected cells leave the knee and migrate to another area with recent damage and inflammation? It's a great question.
And that's a great question, Barb. And it could possibly do that. But what ended up happening is when we prepped that terrain with the shockwave, we allowed those cells to concentrate that first and go into that. So they'll travel along blood vessels and they'll find themselves, like I said before, it's called proliferation. So they're going to go in there and they're going to lay down, if you will, a foundation or matrix to start that repair process, right? So if they have to migrate, other cells migrate to the place of a new injury, that could happen. But I'm assuming now you haven't done that. Please don't do that if you haven't done that. But the best part about it is we're going to continue following up with you. And if we have to use some support with the shockwave, we can reintroduce that, because this shockwave is designed versus other shockwave devices. It doesn't cause any cell damage. It biohacks the brain to concentrate areas, to do an SOS call, if you will. So we can use that shockwave when we do a follow-up with her to see if we need some support to call the cells back to that place of concentration that's needed. So what I'm sharing with you, Barb, is I got you.
Yeah.
But don't go out and hurt yourself.
I'm
Don't
not
ruin our
going to try
artwork,
to.
please.
Not going to try to, but I do. I'm really active. I'm flying away again this weekend, and it kind of crossed my mind. You know, I'm excited about where they are, but what if? Will they move if something happens? Because I know
Fair enough.
they look for areas of damage. That's
Fair
why
enough.
they're there.
So what I can also encourage you is maybe putting on some knee sleeves as an insurance policy.
Great idea. Dr. Chong, too, do you think that the length of time away from the injection too helps? Like if it's been several weeks since those cells were injected, the likelihood of them having to migrate at that point is pretty minimal versus if it like happened the next day. Well, that yeah, they might migrate a little bit there, but several weeks out, I wouldn't expect that to happen.
You're correct, because they already put themselves into a task. They
Yeah.
already have a task they're working on, if you will. So they're not going to be called off the job site.
Yeah. Anybody else have any other questions or comments, ideas, thoughts?
And the goal of this was to donate our time to get information out to you, and whether or not you are ready to do, or you're interested in doing these things, our goal is to just send out the information, whether one person showed up or 100 people showed up, because I feel it was maybe unfair for both Dr. Muth and I to have to travel so far away to receive these procedures.
Yeah.
We are here now, so if we didn't do these type of things, shame on us, because the fact that I don't know who's out there. I don't know who's going to be listening to this now or 10 years from now. But if we don't put this information out there, then shame on me for not sharing the opportunity, so the person doesn't have to go overseas or go across the country and maybe not get the right type of care that they deserve and get maybe marketed into something that is not the right thing to help and support them.
Yeah. Yeah, I had stem cells done in 2014, and I also traveled to Florida then. My husband did too. He's got a horrible back injury, but there wasn't anyone local that I trusted for that. And so I traveled to Florida. We did all of that. My husband had amazing results. I mean, he hadn't felt his feet since 2006, and it was 2014.
Wow.
72 hours of having stem cells injected into his back, he had feeling in his legs again and in his feet. And it lasted until maybe about a year or two ago. He started to notice some issues again. So Dr. Chong is working with him, and we're doing some new stem cell therapy for him here as a little bit of a booster. But yeah, it's nice that nobody has to travel anymore.
Yeah, so look like there's a question asking if they could just do shockwave therapy and not do stem cell therapy. And that's a great question. The best way to find out is to set up a consultation. And when you come in, we'll use a device as a diagnostic, like I was saying, so I can figure out what the best protocol for you will be. And that's why we're offering this opportunity here for those of you on the call here. If you book before August 4th, to have you come on in, we'll run this until that time to help support you and reducing one of the barriers to get you to come in and to have a diagnostic to see if I can help you and what I feel is going to be the best for you.
So this is our special thank you for those of you attending tonight. It's a $199 consult special. Dr. Chong will use the shockwave device on you. So it's not just identifying the spot, you're also getting some treatment along with that while you're doing that, correct?
Correct. Yeah. So we're going to do a map and we're going to do a diagnostic with it, just like we did with you, Barb. And this is a special for the people that are patients, because we know a lot of people that are on here, they might not be patients of ours. So we're opening our doors to you and opening our doors to the public for this opportunity. So those of you who are patients, we consider you the VIP. We want to always offer and support you the things that are offered in the office. Because, I look at these things we're bringing in with the ozone and the UV and all these different adjunctive things that if we didn't share them with you, how would you know they're available? And I don't want to be that guy saying, well, how come you offered to this person? You didn't share this with me because I thought maybe you might not be a candidate. So that's where you share it. We'll decide later when we have a conversation of what things might be best serving to you and your condition.
Awesome.